Every day, you and I get bombarded with negative news. And just like our bodies becomes what we eat, our minds become the information that we consume. If you want to stay positive, it's so important that you also listen to stories that inspires you and uplifts you. In this podcast, we interview world-leading experts dedicated to solving the world's most pressing problems. And if you stick around, I promise you will not only be as informed as if you watch the news, you will feel uplifted, inspired, and have more positive energy in your life. Welcome to Great.com Talks with. Hi and welcome. Today Great.com talks with Catherine Coyne, who is the CEO of New York City's Animal Medical Center. And if you haven't heard of them before, the Animal Medical Center is the world's largest non-profit animal hospitals with over 100 veterinarians. And if you haven't done so already, and if you're new to this podcast, you definitely want to press subscribe on YouTube or in your podcast app, because today we're going to talk about how to raise the quality of life for our animals. And Catherine, thank you so much for taking the time to speak with Great.com today.
Thank you. Thank you for having me.
So how would you describe the Animal Medical Center to someone that is not familiar with the work that you do?
Well, the Animal Medical Center is truly an iconic institution in New York City. We are the single largest nonprofit animal hospital in the country. It was started in 1910 by a group of women to care for animals of New York City. And it has grown now to we'll see probably close to 57,000 visits this year.
Wow.
We have a huge teaching program. We have the largest postgraduate education program for veterinarians that wish to go into specialty medicine.
So it's been along for a really long time. And
Yes.
So tell me more about, because I read on your website that your vision and your values remain intact from 1910 when these women started the foundation. What was their intention for creating the medical center, and how are you upkeeping that today?
Well, the medical center has always had three core missions, and one, of course, is compassionate care for animals. The second is to advance veterinary research and care. And the third is to provide care for those animals that cannot afford care, as well as our education and research mission. As I mentioned before, the hospital in 1910, started by a group of women, has grown now to be this huge animal medical center with over 100 veterinarians, a large teaching program of interns and residents, 20 specialties. So any ology, if you will, like in human hospitals, oncology, pulmonology, cardiology, we have every ology on the human side available for animals in this large specialty hospital. I'm pleased to tell people that we have been open 24/7 forever. We have never shut our doors. In fact, we don't even know where the key to the front door is, quite frankly. During this entire pandemic, we have been open to serve people with their animals, and it's been very clear to us, or maybe reinforced is a better word. We've always known how important the human-animal bond is to people, but during this horrible pandemic, it's really become crystal clear the importance of animals to the health of families. And we're happy that we're able to provide service and to what we really do is keep families together with their pets, and keep their pets healthy. And healthy pets and healthy people really do go together.
Yeah, thank you for pointing that out. I got a bit of shivers when you said that, because I think so many people are feeling lonely during this pandemic, and having that bond with their pet gotta be so much more important in a time like this. So with the pandemic coming in, how is that affecting the challenges that you guys are facing? How did it change things?
It changed things a great deal in terms of operations. And I think the reason that we were able to accommodate everybody, I mean, we'll have as many visits this year as we did pre-pandemic. Now, we did have a little bit of a slowdown early on when people were not leaving their houses. But operationally, we had to no longer allow patients in the building. We had to protect our staff, and we had to protect our clients coming in. So we instituted a a tent situation in our parking lot. We were lucky enough to have a large parking lot attached to the medical center. So we put up two big, we thought they were going to be temporary. It looks like they're now permanent for a while, tents. So what we have are people in PPE, our techs and our nurses that will greet people at the door, take their pet, bring their pet up to the veterinarian, and then the veterinarian contacts the owner in the tent vis-a-vis FaceTime or cell phone to talk about the pet's condition. The pet's taken care of, and we had to bring the pet back down. It's a very complicated, but it works quite smoothly in terms of getting the pet in and out quickly and treated while protecting the staff and the clients. That was one of the big concerns of our frontline people, that you have 200 people coming into a building every day. There's a lot of exposure. So of course, we've done all of the required screenings and the separation between each of the technicians and the frontline people and the clients coming in. We are allowing emergency visit clients to come into our second floor, but they are screened. There's a big screening, a form that we have to ask each of the people coming in, temperatures taken, to keep everybody healthy and everybody safe. Appointments are a little bit different. We've done a lot with telemedicine. That's really blossomed a great deal so that the client can show their pet to the doctor vis-a-vis like a Zoom or a FaceTime, talk about the condition, and then the decision to say, look, you need to bring that pet in. We need to see it physically, or something that we can do for you. We can renew a prescription. We can say this can wait, or any way that we can help the client navigate through not having to come in and out of their own home and in and out of the building. I'm very hopeful that the virus ends soon, as I'm sure everyone else is, because I don't think there's nothing better than a face-to-face relationship with your veterinarian, similar to your doctor. It's one thing to talk to them on the computer. It's another thing to have a face-to-face conversation. So we're looking forward to getting back to that normal relationship with the veterinarians and our clients and their pets.
Mm. Yeah, I can imagine that you're longing to get back to that relationship. And at the same time, I guess there must have been good to have gotten that practice in, okay, what creative ways can we use technology for that can actually be in some way helpful to both pets and the owners. So
Sorry.
No, you go.
I was going to say there are so many stories that I could tell you during this pandemic of people coming in. We treat all of the seeing eye dogs for free, and those people absolutely have to keep their dogs healthy. They're a lifeline for those people. So we do let those seeing eye dog, obviously owners and their pets and their dogs come in. But I think the thing that touched my heart so much were the seniors. And you talk to them when they bring their pet, and they'll tell you, this is having this cat or this dog is the only thing that's keeping me going.
Mm.
Helps me get up in the morning. I know I have to take my dog out. I know I have to clean my litter box. I know I have to feed my cat. It's tied them, and it's taken this isolation and made it less severe, if you will, because they had that pet with them. So I think that that's what's so critical right now, is that people understand the importance of pets and how they need to keep them healthy. And we can do that for people. And so that's what makes me tick every day, knowing that we're able to provide that service.
Mm. Yeah, I can really feel how strong that why is for you, why you're doing this work. So I'm getting really curious, because this center has been along for 100 since 1910, and obviously a lot of has happened in, like, you spend time developing research, like you said. So how has the profession of being a veterinarian changed over the last, maybe 10, 20 years? And where do you think we're going in the sense of what kind of care can we give to our animals?
So I would say that even more than in the past 10 or 15 years, the development of specialty medicine for animals, which really started at the Animal Medical Center, has been at the forefront, if you will, of continuing on with education and research. One of the things that we truly feel strongly about is the Global One Health Initiative, knowing that we can learn from MDs and human doctors, and human doctors can learn from veterinarians. This One Health project globally is very important to have the collaboration between uh, human doctors and veterinarians. There's diseases, almost every disease that humans have, dogs and cats have, diabetes, cancer, heart disease, lung disease. So what the doctors, the human doctors, the MDs can learn from us and what we can learn from them to come up with different approaches to care is critical. I'll give you one example. Several years ago, there was a collaboration between the Animal Medical Center and Sloan Kettering to develop what we call a canine melanoma vaccine. So it's not really a vaccine like we know it today. It's more of a treatment for melanoma for animals. And that continues. The One Health conference this past year brought together over 500 people. It was on Zoom, so we had a lot more participants. But the topic of breast cancer in women and mammary tumors in cats, there's a huge correlation between breast cancer in women and mammary tumors and/or breast cancer in animals. So that project is ongoing, and we're finding amazing things about the, the connection between animals and humans in terms of those disease entities. So we continue on with the One Health initiative. And I think that's one of the challenges going forward is to bring the human side and the animal side together to learn from each other. It's an amazing opportunity. And I'll tell you one story about a dog that came to us from Texas, actually, that had what's called an AV malformation, could not be fixed anywhere else in the country, or at least in that state. So they shipped the dog up to the Animal Medical Center, and we worked in collaboration with doctors from two human hospitals in New York City to address that situation by stenting that malformation. Years ago, we did a small baby horse, or what's called a foal, that had the same malformation that came to us. And as long as we could fit it in the elevator, it was still small enough. We don't really do horses or large animals, but the foal was young enough to fit in the elevator, and therefore it was young enough and small enough to fit in our CAT scan. And we were able to fix that AV malformation for that horse and send it back home with its mother. It all started in the parking lot. We did the ultrasound in the parking lot. We loaded the foal onto a stretcher in the parking lot. It was an amazing story. And the collaboration between the Animal Medical Center, and we're right on Hospital Row. So we have the opportunity to work with all of the best hospitals in the city. And so we have that great collaboration going on, and we continue to push that forward.
I haven't really thought of it as one medicine in the way you describe it. I always looked at being a veterinarian as a different profession, because it is different in a sense. Like the animals can't speak, you're working with a lot more different species, but then maybe a lot of the diseases are the same. So what kind of challenges are veterinarian going through more than the ones I mentioned compared to human doctors?
Well, as you were saying, the difference between the human docs and the veterinarians, it's almost like being a pediatrician in a way, because you don't have a client that can speak. You can only listen to the symptoms that are being told to you by the owner or by the parent. So I think the intuitiveness of veterinarians is incredible by understanding and looking at a sick patient, that you kind of won't have to intuitively know what's going on with that patient. So that's a little bit different. I'm sure that's a challenge. And I think veterinarians would say that that's something that they do, but it's something that they're very, very good at, similar to a pediatrician. In terms of other challenges not related to the actual care of the animals is, veterinarians go to 4 years of vet school, then 4 years of college, then 4 years of vet school. Many of them will do an internship. So we'll have 30 interns come to us this year, and they'll do a rotation through all specialty services. And then they'll go on, if they want to be a specialist, do a residency program. But the point that I'm trying to make is that they spend an incredible amount of time becoming educated, and they come out of college and veterinary school with a tremendous amount of debt. That's one of the bigger problems right now for veterinarians coming out of training, is that they come out with a large debt load. So we are hopeful that that will change sometime in the future for them, as it has changed somewhat for the human doctors with major contributions to medical schools. We're not a medical school, we're a postgraduate training program, so we're not we're not affiliated with any particular college or university, but our postgraduate program takes interns and residents from all over the country. And the
Yeah.
best part, if I may say this, for those people that are coming to the training is they will see in 1 year, even in the internship program, more cases in different types of cases and different species in each case in 1 year than they would see in 30 years of just plain veterinary practice service. So it's an amazing opportunity.
Yeah, I hope the situation changes with the debt burden, because I assume a lot of the people that are going through the education are people who wants to, be of service and has a similar why to the why that you have, that you really want to help animals and see the importance between the link between pets and their owners. So yeah, I hope
They're
that
not in it
changes
for
too.
they're not in it for the money.
Exactly.
They don't make a lot of money. The level of dedication and the level of compassion. Now, I worked 27 years in human hospitals, and I say to my friends back in the human world that if you could spend 1 day in my animal medical center and see the level of compassion that I see each and every day, it would change how human medicine is practiced. I think that's a major difference when you ask me what the major difference between both sides of the medical equation are.
I can imagine. Now, so I'm curious both where you see the future of the animal medical center going, and also how someone that is listening to this and feel encouraged to help you help animals somehow, what they can do to take positive action, participate, and keep up to date with where you guys are going.
So we have a very robust website, and we have what's called the USDAN Institute for Animal Health. It is really the ultimate source for people that own animals on health issues, training issues, nutrition issues. The USDAN Institute is incredibly helpful for owners, and it's not just for AMC clients, it's nationwide. Anybody can access the USDAN Institute vis-a-vis our website. So we will continue to push that forward. In terms of what we're doing now to really secure the future of AMC, that building was built in the early 60s. It was never meant to accommodate the amount of volume of patients that we currently see and or the technology. I mean, we have an MRI and a CT and a linear accelerator that are from the same pieces of equipment that you use in a human hospital. So the building was never built to accommodate that level of technology. So right now we're in the beginning phases of a capital campaign. The campaign is called The Gift of Love, because we really feel that anybody that's giving to this campaign is giving it out of love. It's a major building renovation and expansion project. We're putting about 11,000 square feet of new clinical space into the building and renovating the other 90,000 square feet of the building in order to accommodate and continue to grow the Animal Medical Center over the years. It's a couple-year project. We've started it already. The campaign has not really been officially launched to the public, but will be shortly. We anticipate that it'll take up until 2024 for everything to be done. We will not close at all during that period of time, which has created a lot of challenges in terms of phasing, as you can imagine. But we're up for the task, and we're going to make it happen. So if people are interested in supporting the Animal Medical Center, that would be terrific, and they can do that on our website, Animal Medical Center, NewYork.org. And any gift is more than appreciated, and will go a very long way to securing the future of the Animal Medical Center.
Beautiful. I encourage our listeners to get involved. And Catherine, thank you so much for taking the time to speak with Great.com
It's been
today.
my pleasure.
Very much appreciated. Thank you.
Thank you.
And for you listening, if you enjoyed this conversation, press subscribe on YouTube or in your podcast app, because that is showing the algorithms that this is an important conversation, so more people can hear how we can make the world better for our pets and make the connection we have with them better. Thank you so much for listening, and we'll see you in the next episode. What is Great.com? That is the most common question that we get. And the shortest answer I can give you is that we are a company that is moving money from the online casino industry and donates it to charities that is helping the environment. The long answer, unfortunately I don't have time to tell you today. But if you're curious, definitely Google whatisgreat.com to learn more.